thought we would do something a little bit different today than we normally do, because I often get asked a lot of questions about therapy and what therapy's like. So I thought I would compile the top 10 questions I usually get asked and answer them here in video form so that you have it, and it's a tool and a resource and something you can go back to time and time again, especially if you're on like that precipice of asking yourself, like, am I ready for therapy? I have some questions, but I'm too embarrassed to ask. So I thought, let's put this together. Now, keep in mind, some of these will be more true for me as a therapist and how I work versus other people, but this is kind of like it gives you an overall idea of some of your burning questions. If you don't know me, or if this is the first time seeing my face, I am Denise Marie, licensed therapist for empathetic women. I work solely with women, and I do this by choice, and I love what I do. So without further ado, let's get rolling with some of the questions. I'm going to pull up my document here because I have them all in one space, and we're going to jump right into it. So the first question I get, and this might, to be honest, this is one of those things where you might think, well, duh, but a lot of people ask, what is therapy? I think there's a lot of mixed information out there and a lot of misinformation still, even to this day. And I think there's still a lot of stigma that we're trying to fight against to get this information out there so people feel safe enough to explore it, because I think we've kind of made it into this like big scary thing when realistically it isn't. I like to actually consider it like going to the gym for your soul. I know that is kind of a funny way to put it, but when you're in therapy, it gives you a safe space to really go through and get out, first of all, a lot of those like burning thoughts, those intrusive thoughts that have probably been playing on repeat in your head for goodness knows how long. I mean, if you can relate to that, I know I sure can relate to that. Before I went to therapy myself, I had so many intrusive thoughts that were just playing constantly, thoughts of self-doubt, what if, all these things. I was in a shame spiral about previous trauma, all of this stuff. And it had become so committed to my memory, and then it became committed into my body that it was a story I had told myself about who I was. So the purpose of therapy is to really give yourself a safe space to process and get out a lot of these things that have been almost haunting you, in a sense, for goodness knows how long. And for a lot of the women I work with, it's a place for them to just be themselves. It's something solely for them. I know, especially for some of my moms out there, they really give and give and give and nurture, and they're always catering to other people. So then therapy becomes a place that's all about them, to explore what they want, what they need, what self-care looks like to them. That's really the purpose of it, so that you can have this place to do some of this deep exploration and not feel like you're doing it alone. Because obviously sometimes when it comes to therapy, it's like you can do some of these things on your own, but when you have that collaborative partnership and you have somebody that is the right fit for you, that is working with you and doing this in a very safe way so that you're not becoming re-traumatized or re-triggered, and someone that understands and is trained in how to manage that with you and alongside of you and almost like hold your hand, it becomes a really beautiful partnership. And I think a lot of people think that it's going to be really re-traumatizing. We're going to dig up all the past. We're going to go through all those traumas again. And while yes, that is an element of it, because so often what is happening and what happens in the past tends to mirror in the present. So a lot of the behaviors or the patterns of behaviors or the experiences that you're having could be a result of previous trauma or previous experiences that happened when you were quite a bit younger, or maybe even 5 years ago, that your body has now put you in kind of a fight or flight state. So yes, while there is some of that, I also like to focus a lot more on moving forward, what next steps are going to be, what are some almost solutions or ways to alleviate some of these feelings, and what does it feel like also in the body. I like to always bring it back to the body and incorporate those things, because our body and our mind and our soul, those things are all connected. And I think sometimes traditional therapy focuses a lot on the talking, where I like to bring in a lot of these elements of understanding what it feels like inside the body and understanding those body cues, and really reconnecting to your intuition is another important aspect of the work that I do in the therapeutic space. Now, that's not the same for every therapist, but for me, those are some of the things that I like to focus on. So hopefully that answers your question on what is therapy. And again, as I'm going through this, if you have any other additional questions, please feel free to ask me and I will absolutely answer them for you. Question number 2, how do I know if I need therapy? And this is one of those things where I'm always like, if you're asking yourself that question, like, how do I know if I need therapy? You're probably already halfway there. And this is going to look different for a lot of different people. I'm actually thinking about putting together another video resource for you where I talk about like maybe we could do like a top 10 top 10 signals you might be ready for therapy. But honestly, if you're asking those questions, if you're feeling called and you're feeling pulled, even here in this community, if you've been watching some of my video content and thinking to yourself like, ooh, maybe therapy is something I'd like to explore, but I'm really nervous, I'm really afraid, please know that this is completely normal, and I will do my very best, especially if we connect one-on-one. If you don't know, I do offer free 30-minute consultation calls so you and I can meet in the virtual space and actually see if we connect and see if my services are something that are a good fit for you. But if you sort of know, and I know I came to that point where I had said to myself, like, enough is enough. I know I need to do this, and I don't know what it looks like, and I'm really afraid of it, but if I don't do something, things are never going to change. And that was a really important piece where you get, and I think that's what happens, you get to the point where like, if I don't do anything, things are going to continue going the exact same way that they are, and nothing's going to change for me. And I can't have that, because I can't handle feeling this way, and I need help, I need support. And that's a really hard thing to say, especially for women sometimes, I think, because we've been conditioned by supposed to culture to be these perfect specimens that never have any issues, that never need help, that, you know, you just put on a brave face and pretend to the world and show to the world that you have this perfect life and never lead on that anything's wrong. But another piece of that is understanding and stripping away some of that shame and being like, okay, yeah, that might be what people expect of me, but that's not what I feel 100% on the inside. And I know I need support to move through some of the stuff that's holding me back and to really set me free and allow me to redefine who I am and do it in the way that feels good to me. But again, I want to go through this in another video, so I'm not going to spend too much time here. I'm going to move on to the next question. This is one of my favorite. Is therapy only for people with mental health issues? And while yes, there are certain people that struggle with more serious mental health issues that require more intensive therapy, or maybe working with a psychiatrist or a psychologist to work through some of these, maybe, you know, they've received some sort of diagnosis, maybe bipolar, things like that, or, you know, extreme anxiety or extreme depression. Yes, there are some people that require more intensive therapy for some of those mental health issues. But that is not always the case. As I mentioned earlier, like when I was talking about what is therapy, sometimes it just gives people a safe space to explore what's going on, to allow things to unfold, to really share what they're going through. And it doesn't necessarily mean you have some mental health issue or you're struggling with a mental health issue. It just could mean you're at a place in your life where you need a little support and you need a little help, and you can't do things alone anymore. A lot of this might look like life transactions, going through a life transition where you've done things one way for a really long time and now it feels out of alignment. Excuse me. I had a cough come up out of nowhere. Or enhancing even your overall well-being. You learn a lot of tips and tricks in therapy, and you learn a lot of strategies, grounding strategies, and ways to better care for yourself. So no, you don't necessarily have to have a mental health issue, a diagnosable mental health issue, to be able to benefit from therapy. In all honesty, everybody can benefit from therapy from all walks of life, whether you identify as a man or a woman or non-binary, no matter what age you are. Even youngsters can really benefit from therapy because it gives them that safe space to explore without judgment. So that's really important. You don't have to have a diagnosis to come to therapy. And I just want to leave that at the door. And you also don't have to have had a really traumatic past to come to therapy. I think a lot of us do this thing where we're like, well, my life hasn't been that bad, so who am I to go to therapy? There's people that need therapy way more than I do. So we minimize what our experience is, and we put off getting the support we need because we feel like we don't have any right to have had those experiences, or we haven't had it, quote unquote, bad enough. But it doesn't matter where you're at in your life, everybody can benefit. Even those clients that have said to me, I haven't really had a traumatic upbringing, as we go through their story and we sort of understand where they've been and where they're at now, there are elements of trauma. It might not be those big traumatic events like abuse or neglect, but it could be, it could be bullying, it could be growing up in a chaotic household or an unpredictable household. There are a lot of other things that lend themselves to how we are as an adult and how we present ourselves as an adult. They're rooted in the past, not necessarily in those big T traumas, but in those smaller T traumas as well. So hopefully that answers your question. Again, if you need more clarity, please drop a comment below. How do I choose the right therapist? This is so important. Of all of the questions I get, this is probably the most important one, because for me, when I chose my therapist, I did it based off a picture and based off a bio. Even before I connected with her, I had gone through some options in Psychology Today, and I found her and I was like, this is the right one. I just know it. It was a gut feeling. So that when I connected with her via phone and was able to see how well connected we were, I knew automatically that this was the right fit for me. So that when I got into the therapy office, I was like, okay, I know I made the right decision. But this isn't the same for everyone. I've also had previous experiences where I'd gone to other therapists that weren't the right fit and I never returned. So finding the right fit or the right person that's going to work with you, that's going to collaborate with you, and that's going to make you feel safe is key. And one of the beautiful things about what I'm doing here in the community is that I'm offering you kind of a backstage pass to get to know me, to see how I am, to feel my vibe, to get an idea of how I talk, how I speak, how I work with people, which is what makes all this video content really important, because it exposes you to who I am. And I'm truly what you see is what you get. So you're almost doing kind of like an interview with me, an observation, if you will, from afar, without having to have any skin in the game, without having to actually reach out to me or have a phone conversation with me. Now, some people, it will be appropriate to take it to that next step and we're meant to work together. Other people, no, you're just here to be able to gain new wisdom and knowledge, and either way is perfectly fine. But knowing that this person is the right fit for you and asking for what you need is key. I always ask my clients that I'm working with, like, how do you want me to best support you? Because without that information, it's really difficult to move forward. So this is key, and it's okay to therapist shop and talk to different people and not make any commitments, which is why offering those consultation calls to individuals that are thinking about working with me is really important and one of my values, because I want you to have that opportunity to explore and to know, like, okay, this is for sure the right fit or it's not the right fit, and we go our separate ways. And either way, I'm happy to have met or to connect with anybody, but perfect match is key, because this is work you're going to be doing together, and it's deep emotional work, and you want to make sure that you feel safe with that individual. So this kind of rolls right into the next question is, will my therapist judge me? And whenever I start to work with any new clients that come into my virtual space, because obviously I offer all of my therapy online, so I can work with anyone in the province of Ontario, no matter where you are. So one of the first things I say in those first few moments of that first session is, you are free to just come here and be you. There's nothing you can say that I am going to judge you for. Even if you feel like a lot of shame around a specific thing, if you've made a specific decision or you've made a decision in your past that really felt out of alignment with you and you have a lot of shame around it and a lot of guilt, there's nothing you can say that I will judge you for, because we all make decisions based on the information we have at the time. I'm always saying you only know what you know when you know it. So who am I to judge? You're making the best decision for yourself in that moment. And every decision, whether it's good, bad, or indifferent, has an opportunity for learning there and has an opportunity to garnish and excavate wisdom. So no, I will never ever judge you. You are free to come as you are. You're free to cry, to scream, to swear. I will probably cry and scream and swear with you. I often mirror a lot of what my clients is going through naturally, because obviously I'm an empath, but also that just tends to be because I am emotional as well. So I feel things right alongside you, and I will be there every step of the way. And you do not ever have to worry about saying anything or feeling judged. This is a no judgment zone. And if you talk to any of my previous clients, you will know that they are a testament to that fact, because you will be you'll be unveiling and revealing a lot of really deep emotional stuff. And I don't ever want you to feel like you are going to be judged. So no, never any judgment. Come as you are. Now I have a Nirvana song in my head. I'm aging myself, but let's move on. Number 6, how does online therapy work? This is a good question, because a lot of people ask me that. They've asked me, like, is online therapy just as good as in-person therapy? And yes, absolutely. I have a really unique gift to be able to kind of feel where you're at, feel your energy, understand where you're at, even through a computer screen or a phone screen. All of my success with my clients has been conducted 100% online. And I think it makes for one thing, it allows for you to feel like you're in a really safe space, because you can go anywhere. I've seen clients in their closets, in their cars, on the side of a road, in a beautiful forest. It allows you to really pick a space where you feel safe. Some clients are in their bedroom, they're at work, and in a boardroom. No matter, like, whatever safe means to you, you can be anywhere, wherever you feel comfortable. And another beautiful part about doing therapy online is you're not rushing for an appointment. You're not, battling the weather, trying to find parking, having to get yourself dressed. You can come in your pajamas. It doesn't matter to me. You can come eating dinner. You can come as you are. And this again goes with the judgment piece. I've seen clients in their bathroom, because this is the only place that they can find that they feel safe. So this is kind of one of the wonderful things about therapy, and it is equally as effective as in person. So yes, it does work. You will see results. And that takes me into question number 7. How long will therapy take to see results? Again, this is very individual. Some people need, I always say, like, when we're starting therapy together, the first 4 weeks are key. This is a lot of those period of, like, we're going to see each other once every 4 weeks. Like, once a week for 4 weeks in a row, because there's a lot of work to do in terms of like, there's a getting to know you period. There's what I like to call emotional show and tell, where you're just going to be telling me things and nothing's going to really make sense. And it's just going to feel like you're all over the place, like almost emotionally dumping, but that's totally normal. And it's a really important piece because you have so much here that has been in your head for so long that it's important to be able to allow that to flow out. So the first 4 sessions are typically once per week for the first 4, and then we take it from there. Some people need a 5th one or a 6th one. Some people are ready to go, every other week at that point. And typically we do, 4 right in a row, 4 every other week. And then we sort of assess. We ask ourselves, okay, where are we at now? It's been a couple of months. What work do we still have to do? Are we ready at this point to go once per month and it becomes a monthly tune-up? It really depends on the person, and it depends on, what we're trying to reprogram, what we're trying to do in the therapeutic space, what we're trying to move through, if we're working on self-forgiveness. It's really dependent on the individual person. And I wish I could just say it takes 8 weeks or it takes 3 months or it takes whatever. But I can't say that with 100% certainty, but everyone is different. And keep in mind also, even as you go through therapy and you move through one thing and you're feeling really great, you'll at some point get to this position where you're like, oh, I have something else coming up for me. Personal development is a lifelong journey, and we evolve and we spend some time here in this new evolved space where we've worked through a lot of our trauma and we're, setting boundaries and we feel good, but then something happens and we become triggered and then we have something else come up for us. So it could be that you're doing this in phases where you do, a period of time where 8 weeks we see each other and then there's a pause and then something comes up and we do another couple of weeks and work through that together. So it's kind of an ongoing thing, but it's different for everybody. And I'm really good about understanding where you're at and working with you and collaborating with you so that we're not wasting any time. I always say to my clients, my goal is to not keep you forever. It's to support you in the now and give you the tools to be able to move forth into this next period of evolution until it so comes up again that something else is coming up and then we meet again. But once you've gone through the process once, it becomes a lot easier to sort of manage some of these things that come up in the future. And you might just need to come back, maybe once a month or once every couple months, just for, I call it like an oil change or like a tune-up, right? And that seems to really resonate with my previous clients. But I wish I could say like it takes X amount of time, but that would be false. And I don't want to give you any misinformation. So hopefully that answers that question. What happens in a therapy session? Also a good question. A lot of people are afraid to come because they're like, what am I going to talk about? And that's part of that is me knowing what questions to ask and having a good sense of being able to get in there with you and make you feel safe enough that you can start to unravel some of these things that are coming up for you. A lot of it is in the beginning is me asking questions or asking you some of your goals or, checking in with you. And I know for some of my clients, they'll always come to the session and be like, I have nothing to talk about. And then for the next hour, they talk about something. So it really is just dependent. In terms of what happens, a lot of it will be like, okay, let's pay attention to how our body feels, or let's understand how our intuition works and what does that sound like. You're going to get grounding tips and you're going to get strategies and how to, set some of those boundaries. And just really, it's going to be dependent, but it's never boring, that's for sure. And it's never quiet. The hour goes by very fast every single time. I feel like it's almost like a funnel. Like it's like, shoom, and all of a sudden the hour is done. But don't be scared. I will always guide you, even if you feel like you don't know what you're doing, because there's a lot of fear when you come to therapy for the first time. I got you. Don't worry. I will support you. Can I bring up anything in therapy? Yes, this goes along with the judgment. You can bring up anything. Absolutely anything, whether you feel like it's relevant or not. I have some clients that want to come in and talk solely about something that's going on at work for an hour, and that's okay. You can bring up whatever you want. It's my job to meet you where you're at. Obviously, my role is also to challenge you, to challenge you to see things in new ways, to support you as you break patterns. But I meet you where you're at. That is my job, and then we take it from there. Anything is up for grabs. Anything and everything. This is your space. This is about you. It's not about me. It's not my job to tell you what we're going to talk about today. It's up to you to bring some of those things to the table, and it's up to me to collaborate with you. Number 10, how can I start therapy? In terms of me, myself personally, and I'm gonna tie in another question here because I want to provide full transparency in terms of the work that I do, because I want to provide some pricing as well too. So how can you start therapy? The first thing you can do is if you feel like I'm a good fit, reach out to me, drop a comment below, ask me to reach out to you, send me a message, and just ask me some questions. That is how you start. Just asking those questions with no with no need to feel pressure. I'm never going to get you on a call and pressure you into therapy. That's just not how I roll. That's not aligned with my values, and that's just not who I am. I'm not going to use any slimy sales tactics. No way, Jose. I'm not going to challenge your objections. No, it's up to you to feel like it's the right fit. And I am there. And if I don't feel like you're the right fit, I will refer you on to somebody that might be the right fit. I'm not going to take you on if I don't feel like I can support you. So that's that. So the first thing you can do is message me. Let's set up a consultation call. Let's have a chat. Let's figure out if it's the right fit. In terms of pricing, my price is $160 per hour. This is going to vary from therapist to therapist. Some therapists are a lot more expensive. Some therapists might be a little bit less expensive depending on how much experience they have. But that is my rate in terms of market rate. That seems to be right in the middle of the pricing. If you have access to benefits, I fall under the social work umbrella. You can check with your insurance provider, whether it's through yourself or perhaps you have a spouse or perhaps you have independent insurance. If you have any amount, what I do is I provide your receipt after every session so that you can then go and submit to your insurance company and be able to claw back some of that investment, because therapy is an investment. It's an investment in yourself, and there's no two ways about it. And that can feel really scary because you're going to have all kinds of thoughts like, what if it doesn't work? What if I fail? What if? But what if you can reframe that and say, what if it works out? What if this changes my life? Because for me, therapy changed my entire life. I wouldn't be standing here right now doing this work, doing what I'm supposed to do, had I not started therapy. And yes, it was an investment. And yes, that was uncomfortable. It's going to be uncomfortable, 100%, especially when it comes to making an investment in yourself. But it's probably one of the most incredible decisions I made for me, and something I saw the biggest benefit of. So yes, you can put it through insurance. Those are my rates. If you want to work together, you want to see what working together is like, all you have to do is simply message me, and we can take it from there. But yes, hopefully that answers all your questions. If anything else comes up for you, please let me know. And I will try and do another video talking all about how to know when you're ready for therapy as a complement to this one. But with that, I am going to go, and I'm going to go about my day. And I hope you have a very gentle day, and I will see you next time.